This is my client with a very good shirt. And interesting case because he has a leg length difference side to side, and he uses a heel lift. And how tall is that heel lift?
7 millimeters.
Okay, and that's about the max that you'll tolerate inside a shoe. Okay, let's have you lie on your back. And what I want to demonstrate is that your pelvis is not malaligned. You don't need a pelvic adjustment or correction. But you have a developmental asymmetry in the height of your pelvis. And for that reason, we have to deal with that in sitting, not just by use of a heel lift. So in supine, his pelvis appears fairly symmetrical as far as I can tell visually. I'm not a laser, I don't have a laser apparatus to, measure side to side. But anyway, mobility is good in terms of posterior rotation. And mobility on the right side is really good in terms of posterior rotation.
Yay.
Looking at his feet, I know the camera isn't pointing at his feet, but you can see when his shoes are off, you can see that the right leg is in fact shorter by about 3/8 of an inch. Let's have you lie on your stomach. So there is a pattern where the pelvis twists and loses mobility and requires a maneuver to restore position and mobility, but your pelvis has excellent inferior mobility on both sides, and I can rotate it anteriorly. I can create superior glide mobility through each side, and so there's no need for a treatment to try to change his pelvis, but his right hemipelvis is in fact shorter than the left, and it looks to me like it's about 1/2 of an inch. Looking at the ischial tuberosities, I see relative symmetry. But I'll change the camera angle and see if we can demonstrate that a little bit better. I don't know if we're going to be able to, but we'll try. So we're digging into this part of the ischium that I call the posterior iliac shelf, and the right side is more inferior towards his feet. So his development was such that this hemipelvis is shorter than this hemipelvis. And so I'll show you how we deal with that in sitting. So go ahead and go sit.
Face away or toward?
Oh, just go sit in that chair in the hallway.
Okay, so I'm going to pull it out.
Sure, that's fine. So we looked at him in sitting, and we found that he had asymmetry of his thigh bones, and his left thigh was longer than the other. Bring your feet together, please. Good, make sure they're equal. Yeah, good, very good. Okay, so what we did was we bought some 1/4 inch cork, and we cut it in half. So now he's got a 1/2 inch of cork, and he's putting that under the right sit bone. And we already looked at this, we already did the experiment, and that lengthened the right thigh by repositioning the pelvis. And more important than how things look is how things function, and part of function is how this feels to you, kinesthetically, comfort-wise, and how does it feel?
It feels better. It almost feels lighter.
Very good.
There's like it seems counterintuitive being lifted up, but it feels like I'm not as heavy on the right sit bone, if you will.
So you feel like you're sitting maybe a little straighter?
I couldn't say that yet. I just feels lighter, and I want to put this in my car and wherever I sit at home.
Yeah, and the test will be long-term comfort. Like, how do you feel on a 1-hour drive with it compared to how you feel without it?
What I'd like to send you is, in 6 months or so, another seated x-ray to see if there's a change in the lumbar spine.
Okay.
With that whole rotated and twisted L4.
Yeah, yeah.
Because I think this could be it. This change here was a test I've never seen.
Okay.
is checking the leg length equality. It's always been supine or standing. I've
That's
never
right.
seen it seated.
Never seen it seated, yes.
Which basically isolates it to the pelvis.
That's right.
And that's pretty freaking awesome.
Very good. Well, I'll stop filming now, and thank you for letting us film this.
Oh, thank you.
And we'll finish up with that nice t-shirt. Oh. Very good.
Do you want
thank
me to explain it?
I got